I'm Keith Corbett. I'm from Brookings, South Dakota, and I'm retired. I've retired 3 times now and just keep going back to work because I like working. My optometrist had said, you're getting that age, your cataracts are getting worse, and I just didn't want anything messing with my eyes. I don't wear contacts because I didn't want to touch my eyes, and so I was sitting home at night and watching television, especially the late news, and I'd notice everything was getting cloudier, and I'd turn the lamps up higher, and my wife said, you really got to do something with those cataracts. And so I contacted my optometrist, and she looked, she said, now is the time. And so I reached out to a couple friends that had just had it within the last year and said, tell me about cataract surgery. And their comment was, don't delay, get it done, be the best thing you ever did. And then I said, who did you go to? And they said, Dr. Knudtson. Well, I'm a big believer in supporting the local everything, businesses, the hospital, certainly. My theory is always, if you don't support them now, they won't be there when you need them. And knowing that Dr. Knudtson was right here in Brookings, they strongly recommended him. My optometrist made an appointment for me, and I went in, met with him, and we discussed it, and he looked, he said, now's the time. And just that comfort I felt just visiting with him and the concern he exhibited, and plus friends saying, yeah, you'll be glad you did. Very welcoming, friendly individual. I just felt like I knew him all my life, just the few minutes in there, and he reassured me that after he'd examined my eye, of course he welcomed us, just the fact that he came out to the lobby, he said, come on in, Keith, and let's talk, and just, like two old buddies talking, and once we'd gone through it, and he looked at my eyes again and said, yeah, I think we really need to do that. And then he explained the procedure in great detail to me. I like details, and what would happen, and then what my eyesight would be like afterwards, and depending on the lens that I wanted to have put in and replaced. We've got a fantastic healthcare system here. People at Brookings have been very supportive to make sure we have this. And the hospital staff and the administration have done a great job of ensuring that procedures are available here, that they're well-staffed, and when you arrive, you're well cared for. You know the people, and in our case, we've been here a couple times, so I had the same nurse or nurses, and it just the level of care, you felt like, with a relative taking care of you. I just feel like I can see better. I don't need to have the lights on at night when I'm watching television. And, I still take my glasses off when I read. But I don't know, I just feel like, like I'm back to whatever I was once upon a time before the cataracts and the cloudiness really impacted my life. In the mornings, when I get up, I always have my glasses in the same spot. And I'd put my glasses on, walk out to get the paper in the morning, and after the procedure, I didn't. And my wife one morning gotten up and said, where's your glasses? I said, oh, right there. And she said, why don't you have them on? I said, oh, I guess I didn't need them. And sitting watching morning news and didn't have my glasses on. I do wear them now, but it's just right afterwards I said, oh, I can see fine without them. And I find myself going out to get the mail or whatever. I don't put my glasses on unless I have to. When you're checking in, whether you're going through ER or if you're going in the southeast door, they call you by name when you walk in. And then when they're doing the insurance, they've got everything pretty well organized for you. And just go through, and the nurse will come and get you, call you by name and take you back. And just even when I was having procedures, my wife would be in the room, and then they'd say, Roxy, we want to show you where the coffee is, where the cookies are, where the rolls are. It just, caring about my wife as much as me. And that meant a lot to me. It's a fantastic facility. I defy anyone to find a better facility. It's close, it's right here, but also the fact it's convenient. I can drive from 10 minutes to my home and be here. And the level of care, the physicians, the nurses, everybody here that just treats you like your family. And you're not a number. Get it done now. If you have questions, give me a call. I'll explain to you why I did it. I just such a big believer in it, and definitely go to Dr. Knudtson. I know there are others in other towns, but just the fact you could be right here in Brookings. We didn't have to stay overnight someplace. We could drive right here, be here in the morning. When they told us to be here, everything worked out great. You get that hometown feel of Brookings and the healthcare system, and they've got the best staff in the world, and Dr. Knudtson and his team are just outstanding. And the way he took the time to explain everything to me, I felt so much more at ease. And so I'd say don't wait.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.